Good evening and welcome to Doctors on Call. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth, and I will be your host for our program tonight on mental health problems. We would be glad to take your calls on depression, panic attacks, anxiety, addiction, and other mental health problems. The success of this program is very dependent on you, the viewer. Please call in your questions and we will do our best to address them. The telephone numbers for your questions can be found at the bottom of your screen. Our panelists this evening include Dr. Gary Davis, Regional Campus Dean at the University of Minnesota Medical School and a clinical psychologist, Dr. Victoria Herron, a family physician with the Rader Clinic in Cloquet, and Dr. Margaret Saraceno, a psychiatrist with the Human Development Center. Our medical students answering phones tonight are Derek Andurst of Sauk Rapids, Minnesota, Bradley Nix of Melrose, Minnesota, and Melody Shepard of Lake Benton, Minnesota. And now on to tonight's program on mental health problems. Well, I think the first few questions I have are just going to be around mental health issues regarding access and care. And maybe I start out with you, Dr. Davis. Are there access problems in rural Minnesota to mental health services?
Well, I think, Dr. Johns, like any services in rural Minnesota, there are access problems, particularly acute among mental health problems. As you know, I know there's a shortage of physician providers even in many rural communities. But the problem with access to mental health providers is even more acute than that. And the consequence of that is often that the family physician, like Dr. Herron, ends up being the de facto mental health provider for most rural communities.
So, Dr. Herron, basically, Dr. Davis had just mentioned, you must see a lot of mental health issues in your clinic, is that right?
We see quite a bit of mental health issues in our clinic. That is a very common reason for people to come in, because they can get an appointment to see somebody in primary care, whereas to try and get in to see a psychiatrist or even a psychologist, there's a wait if they can get in at all. So they come in to see us.
Has that been a trend? I follow up on that question. Has there been a trend lately? Have you been seeing more and more of that? Or has it been that way all along over the last few years?
It may have been a bit more recently, but that's been the case for years.
Oh, okay. Dr. Saraceno, so why aren't there more psychiatrists out there, out and around?
Well, I think that's probably multifactorial. You know, when people go to medical school, not everybody wants to be a psychiatrist, but I think there are a good number of psychiatrists, but not enough, because I think the demand is much higher. And I don't know if that's because people are more aware of mental health issues. The stigma against mental health care has gone down, and so people are more willing to get help. Societal changes, stressors. I mean, I think it's multifactorial, but there certainly is not enough of us, which is why we are very grateful that primary care physicians are often the first line for treatment, and then we get people that after they've tried a few medications, they're still struggling, and then we come in and see what we can do to help people.
Dr. Davis, over the years, have there been a change in gender, say? Has it become more common for men to come in than women, or has it always been a 50-50, or how would you say?
Actually, it's been more common for women over the years to come in for mental health services than men. And I don't know if there's been much of a change in that.
Still that way?
Yeah, it's still that way. Women, depending upon the diagnosis, may be more likely to have a particular problem. For example, depression, around twice as many women have the disorder of depression than men. So the base rate may be greater depending upon the disorder for women coming for mental health services than men. But women have always been, I think, better able to reach out for help and feel more comfortable with that than men have been.
Mm-hmm. Dr. Herron, do you what's the most common type of mental health issue that people come in to see you for? What do you say?
Probably a toss-up between depression and anxiety, and very often it comes with a little bit of both. And it's interesting, it can start at a very young age, though below 18 there's a different set of guidelines for treating than over 18. But we get a lot of people who will come in, say, because they just decided that things got bad enough that they needed to come see the doctor. And then we get the people who have been, dealing with it for years with different physicians, different mental health professionals, been on meds, been off of meds, been to see different counselors, been through a lot. Mm-hmm. And still they end up in the primary care office. So depression's up there, anxiety's up there, panic attacks are up there. We get some bipolar, but really try and get the bipolar people off to see their psychiatrist. And try not to get too much into the nuances of personality disorders and splitting hairs. We're just trying to take care of the bigger issues and the finer details, really try and find some mental health professionals to get people to go see.
So, Dr. Saraceno, if a patient, say, recognizes that they may be depressed, or would you recommend that they see a primary care physician to start out with? Would that be a good approach for them?
Would I personally, or would
would you would you personally? No, I mean, in your opinion, if there was a patient that had those problems.
Mm-hmm. I think for a first-time depression, it would be good to see the primary care physician, because you do want to rule out any medical cause for the symptoms, for sleep disturbance, loss of appetite, fatigue, poor concentration, things that are affecting their life adversely, so they're not functioning to their potential. I think it is a very good thing to at least go and get a physical exam, make sure that there's nothing medical going on. Primary care is going to be easier to get into than psychiatry, that often has 3-month wait lists, so definitely go in to see the primary care physician, rule out the medical, get started on something as one waits to get in to a psychiatrist. I think it's a good idea to get into therapy. Medications alone don't often treat depression. A combination of medications plus therapy, if not therapy alone. There's good evidence that therapy can change the neurochemicals in the brain. It might take a little bit longer than meds, but you can do it without medications too, if it's a mild to moderate depression. I think if it's severe enough, then you need to consider the medications.
Thank you. Dr. Davis, we have a caller from Duluth who wonders, what is ADHD?
ADHD, Attention Deficit Hyperactivity Disorder. It's a condition that is diagnosed in childhood for the most part. In fact, I think you have to have been diagnosed with that even if, in childhood, if you have still the condition in adulthood. It's characterized by inattention symptoms, difficulty focusing and paying attention, hyperactivity, being impulsive, blurting things out in the classroom, not being able to sort of rein in one's behavior very effectively, or a combination of the two. Fairly common disorder among children and adolescents, very commonly treated with medications. Dr. Saraceno could address that issue. And not uncommonly persists into adulthood.
Dr. Heron, another caller wonders, what is anxiety? Is there a definition for that?
Oh, anxiety is just that kind of pervasive feeling of dread, worry that won't go away. Everybody worries normally over some things, but when you just can't get rid of it, even when there's not anything to worry about, you're still worrying. That's anxiety. And it's pathological, as in it's a disorder, it's a problem when it's a problem, when it stops you from doing things, when you can't get the stuff done that you need to do because you're worrying. You can't get your chores done, you can't go to work, you can't take care of the house, you can't sleep because you're worrying. Then you have an anxiety disorder. That's more the generalized anxiety disorder.
Thank you. Dr. Saraceno, here's a caller from Ashland would like to know. She's been on an antidepressant medication for 20 years. Sounds like she's doing well, and she wants to start weaning off of her antidepressant with her physician's assistance. What's the best way of going about that? Or doing
Slowly.
it? Slowly is the key, huh?
Slowly is the key, and it depends on the medication, if it's a longer-acting medication versus a shorter-acting medication. Short-acting medications, you have to go very slowly because as it gets out of your system, if it goes too fast, you can have withdrawal symptoms. But I think one thing to consider, the reason for the slowness is that if somebody's had one bout of depression, they have about a 50% chance of relapse. 2 discrete bouts of depression, more like a 70% chance of relapse. After 3 discrete bouts of depression, some people say stay on the medication for the long haul. I think if she's been on for 20 years, then there would be a good chance that there might be some symptoms that creep up. So you'd want to catch that quickly and go slowly.
Are there certain times of the year that are better to try to go off antidepressants?
You would not want to try going off under high stress situations in life. And, some people get seasonal issues, come fall and winter. It can be harder to come off your antidepressant if there's a seasonal component to the symptoms.
Thank you. Dr. Davis, a caller from Duluth, wants to know, how can family members help a depressed person who doesn't want help? And that does happen.
That happens commonly, and that's a real challenging problem. Support. I think one of the characteristics of depression is when you want to be left alone, you're not feeling like interacting socially, you tend to force people away, or people are intimidated or just withdraw from you. Not the right response for family members to make, or friends, actually. I think you stay engaged with the person, continue to be supportive, and encourage them to seek help without badgering or nagging about it, because that's not particularly useful. Offer to go to an appointment with the person, either to their primary care physician or to a mental health professional. Sometimes people are afraid to go alone. In fact, I've often said to patients who come to me for the first time, sometimes I feel like a dentist. People are really nervous and anxious about coming the first time. They're not sure what to expect. And so being with a family member or friend can sometimes be very helpful for the first visit. But stay engaged, stay involved, remain supportive.
Thank you. Dr. Heron, a caller from Superior would like to know, why can I remember things from 80 years ago but not yesterday?
There's a difference between long-term memory and short-term memory. The long-term memory got in there. You made the memory 80 years ago and you made it good and it stayed. The thing about short-term memory is until the memories get in and cemented, they can get out of there pretty quickly. So if you didn't actually lay down the memory to the point where it's stuck, it's gone. So the stuff that you put down 80 years ago, you did well. And unless you really made the effort yesterday, and it may take more effort now than it did 80 years ago to make a good memory, it didn't stick well enough and it slipped out.
Thank you. Dr. Saraceno, speaking of memory, a caller from Ashland would like to know, do antidepressants have an effect on memory?
Certainly can.
Good or bad?
Both ways.
Both ways? Okay.
Can help. I mean, part of depressive symptoms, some of the manifestations are poor concentration, not focusing, fatigue, low motivation to pay attention. So if you treat the depression, the memory can improve. The mood and the affect and the concentration and all of that can improve, but there can be some cognitive or thinking side effects of the medication. The only way to know would be to come off that medication and see if that memory clears. But certainly memory issues are multifactorial. You have to look at age, you have to look at other medical conditions. Is there any kind of, little strokes in the elderly people that could make the memory worse? I mean, that could be a whole session of talking about memory. So,
sure.
Yeah.
Thank you. Dr. Davis, now here's a good question. How do psychologists or psychiatrists know when a patient no longer needs to be seen? So if they start seeing
that is
you,
a great question.
if they start seeing you, do they have to see you forever? Do people?
Hopefully not. Those are my least favorite kinds of patients, actually, ones to stay around forever, because we like to see them get better, become more fully functional. You look for a resolution of symptoms. Dr. Saraceno mentioned a number of the depressive symptoms a few minutes ago: difficulty sleeping, depressed mood, loss of appetite or increased appetite, and so forth. So you're looking for improvement in symptoms, but you also look for improvement in quality of life, in effectiveness in daily activities, getting re-involved in a more fully functional way at work and in social lives. And generally, people are pretty good about announcing when they're ready to stop coming. because it's it's just another thing that you can not have to do in your daily calendar. So people are pretty good about telling me when, I think I'm doing pretty good now. I'm not sure I need to see you as often or even at all.
Oh, very good. Dr. Heron, speaking of memory difficulties, maybe you're the memory person tonight. A caller from Duluth would like to know what's the difference between Alzheimer's and dementia.
Okay. Alzheimer's is a type of dementia. Dementia is a broader term that includes Alzheimer's plus others. Many little strokes will give you multi-infarct dementia. There's other things that can go wrong with the brain. There's Lewy body dementia. You can get a type of frontal lobe dysfunction that'll give you a different type of dementia. Alzheimer's is a specific type where you get little neurofibromatosis tangles and special little plaques in your brain, and that in specific is Alzheimer's dementia. You can't really cut apart anybody's brain and look at it before they're dead, so it's more a clinical diagnosis. It's more gradual onset of memory problems, not so much in the way of hallucinations, not so much tremors. Each type of dementia has their own little unique type of things. So hopefully that's it.
Thank you. Dr. Saraceno, a caller from Mellon, Wisconsin wants to know, can extreme case of anxiety cause a heart attack?
Wow. I would think that if the blood pressure and the pulse goes up so high and somebody has a cardiac condition, there can be a medical complication from it. Not often does that happen, though. That's the anxiety. Oftentimes people have a panic attack where their heart races, they get short of breath, they get dizzy, they get lightheaded, and they fear that they're going to have a heart attack when it's actually a panic attack. And they need to learn skills to settle themselves down. But certainly there always can be, it depends on their medical history of whether that truly can cause someone to die. But usually it's a panic attack, and treating the panic disorder can be helpful.
Thank you. Dr. Davis, a caller from Cloquet, wants to know regarding stress again. Can stress trigger bipolar disease?
Well, the triggers for bipolar disease are complicated and varied. Certainly stress can be a trigger for any psychological disorder, including a bipolar depressive or manic episode. Stress, the consequence of stress is we all generally don't function quite as well when we're under a lot of stress, and if you have a pre-existing psychological disorder, then that certainly can be a trigger for it.
Dr. Heron, a caller from Cloquet actually would like to know, do people get more emotional as they get older?
I would say everybody does their own thing. There may be some people who get emotional more so, and I think some people get less so. I don't think it's fair to generalize.
Okay. Thank you. We have a medication question from Superior. The ADHD medication, Dexatrin, what is the long-term effect of using it?
Dexedrine? Yeah.
Dexatrin, yeah.
Dexedrine, I think.
Dexedrine.
Dexedrine, that's a common stimulant for treatment of ADHD. There's Ritalin, there's Dexedrine, there's Adderall. To my knowledge, there are, I might be hitting that, sorry, no long-term bad outcomes or side effects of the medication. Certainly there can be side effects of any medication, but it's generally a quick-acting medication, gets in within your system within a half an hour and lasts for a few hours depending on your metabolism. And but I haven't heard any long-term bad outcome from using the medication.
Yeah. I do know some parents have concerns because it is a stimulant and the kids don't eat so well. So you have to nag them to eat, and some parents get concerned if their kids don't eat and they're not gaining weight properly, though how much of impact that has on their growth is debatable.
There are studies that show that children will eventually get to the height and weight that they're supposed to get despite being on the medication. And, some people have concerns, well, if I use the stimulant, am I going to become addicted to the medicine? And really, there's a risk of addiction of untreated ADHD, and the studies actually show that if you adequately treat the ADHD, that there's less risk of substance abuse.
Interesting. Maybe I can follow up with a question. Another caller wanted to know, at what age should you allow a child or young adult to handle their own medications?
I think it depends on the maturity of the child.
Depends on the child.
I know 15-year-olds and 16-year-olds that need to be told to take their medication, and there's 10-year-olds that get up in the morning and they take their meds. And so I think it really is
individual.
Thank
you.
I think it depends some on the overall adjustment of the child, too. And what you don't want is for children to have access to the medications and be selling them or sharing them with their friends. And that can be a problem.
Dr. Davis, there's a caller from Hibbing would like to know, is there a cure for bipolar disorder? Is that a curable illness? Or
Yeah, because I'd like to duck that question. Well, I think that's a question that one size doesn't fit all. Some people certainly seem over time to function much better if they've been diagnosed with bipolar disorder. Some people seem to continue to struggle throughout their lives with it. I think generally we look at bipolar disorder as a chronic psychological disorder that hopefully can be effectively managed with medication and therapy. But in terms of going away, that's really a murky area. And like I say, some people function better over time and don't seem to have as many depressive or manic cycles if they have that, and other people just continue to struggle. And it also depends on how many other problems they have associated with it. Sometimes bipolar disorder is associated with substance abuse. And that certainly complicates overall effectiveness of one's adjustment.
substance abuse, makes everything more difficult when it comes to mental health issues?
Makes everything more difficult, definitely.
Yes.
Makes treatment more difficult, makes the disorder worse.
So what do you treat first? The substance abuse problem?
Both.
Treat both.
Yes. Try and do both.
Okay.
I think historically we used to say you have to treat the substance abuse first and then you can go on to the psychological or psychiatric problems. But really, I agree totally. You have to address both first.
Dr. Heron, do pain medications interact with anti-anxiety drugs? A caller from Duluth would
Yes,
like to know.
you do have to be a little careful. They both tend to be a bit on the sedating side a lot of the time. And different people have different tolerances to meds, so short and sweet, yes.
Okay. Basically, next question is from Duluth. Can antidepressants be the cause of my dizziness and crummy feeling, even if my dose has been cut in half? So what are common side effects, say, of antidepressants?
Well, it depends on the antidepressant, but certainly you can have dizziness, lightheadedness, stomach problems, sleep disturbance, activation, irritability, suicidal thoughts. Even though you want to treat that, you can have the rare risk of that getting worse. So yeah, there's a whole host of side effects. That's why you need to be followed closely.
Can a caller from Duluth would like to know, Dr. Davis, how soon in talk therapy will any benefit be seen versus starting on drugs therapy?
Boy, another...
I've been giving you easy ones today.
Yeah, hard to make a generalized answer to that. We talk about, if we talk about depression, for example, antidepressants, that 4 to 6 week window is sort of the way we think about the period of effectiveness, if they're going to be effective, of medication. And it may be 2 to 3 months for talk therapy. So talk therapy generally, it's slower engaged, which is sometimes why people start a medication as well as get involved in talk therapy. But you want to be careful about the term talk therapy. That's very generic, and what we do know is there's a couple of very specific, quotes, talk therapies that have been demonstrated to be quite effective in depression, and people may have heard the term cognitive behavior therapy. That's clearly the best researched talk therapy, if you will, for depression, and has very good outcomes associated with it. There's also another psychotherapy approach called interpersonal therapy that also has good outcomes associated with it. But it's not clear that just showing up in a counselor's office once a week or once every 2 weeks and talking has a whole lot of benefit.
Less side effects.
Yeah, less side effects to medication, certainly.
True enough. And finally, just a question for whomever wants to grab. We're in our last minute here. Can increased water consumption reduce the effect of my lithium?
Yes. Lithium is a salt, and so just like if you eat chips at the Mexican food place and you drink a lot of fluid, you wash the salt out of your system, you can wash the lithium salt out of your system. So you don't want to drink too much water. Don't want to get dehydrated either.
So it makes people have a thirsty feeling?
You can get increased thirst and increased urination, but you don't want to drink too much because it'll be less effective if the level goes down, which is why you need to monitor that closely.
Interesting. Well, thank you. Well, I'd like to thank our panelists, Dr. Gary Davis, Dr. Victoria Heron, and Dr. Margaret Saraceno, and our medical students, Derek Anders, Bradley Nix, and Melody Shepard. Please join Dr. Ray Christensen for a program next week on men's health, when his panelists will be Dr. Roger Miller, Dr. Jake Pernowski, and Dr. Paul Tonkin. Thank you for watching, and good night.